types of diet. The one that is ketogenic, there are many people who maintain good health by using a ketogenic diet.
That the mortality in developing countries, the mortality is predominantly due to infectious disease or trauma.
So when I talk about resistant starch, so anything that's not been digested in the intestine is resistant starch. Now, a good clinical tip is that when we have a lot of fiber, we have a lot of resistant starch, and the resistant starch is actually a substrate for the microbiome.
The chyli microns gain blood vessel access through the neck veins, and it's distributed to the rest of the body.
I'm Dr. Selvam. I have been in medical practice for the last 32 years. And my thoughts changed about 20 years ago when I was trying to treat myself of chronic sinusitis. I started taking antibiotics for sinusitis when I was a medical student. That didn't relieve my problems even after I've had 7 surgeries for sinus. So the question is the treatment actually helping me? That's when I explored the natural way of healing. So I explored diets, various types of diets, and it worked very well. And I started to experience the great benefits in my health and the patients that I started to treat. Then it came to a point where I asked myself, am I going to limit these benefits to me and my patients, or am I going to be the one who's going to start teaching and training doctors in all these treatments which are actually natural to the body, because it does not involve almost always any pharmaceutical drugs. So we started this society called Sahamm, and we named it as Sahamm, the Society for Advancement of Hormones and Healthy Aging Medicine Malaysia.
To lift their protein levels, and you get them onto the testosterone, because invariably their testosterone levels are low.
And beta-carotene gets converted into retinal, and retinal can go to either retinol or retinoic acid.
Incidentally, it's not that rare. You got no idea? Who can tell me what's the percentage of an MTHFR polymorphism in the community?
Mine is a group practice where we see a lot of this type of patients who are metabolic diseases, and there is just no option out there available for them. So attending this nutritional certification course gives me an option to share with them, to empower them, enable them, inspire them to healthier living. So that's why I'm here today. Thank you.
I'm so happy going in Sahamm because more learn, more fun, and like we are a family, and the lecture so useful for my practice, my family and myself.
Okay, this is my first time attending the Sahamm conference. I found it very interesting. You know, we've been practicing Western medication all along, giving drugs, giving medicines by the bag full, you know. But patients complain also, and they tend not to be compliant. Okay, so by attending this course and studying more about nutrients, hormones, vitamins, I think it's the way forward. It's the future. Okay, because telling patients these are all natural substances, natural things that are available everywhere, you know, is the way forward, I think. And this is going to be the future, and I hope I'll be able to learn more in the future Sahamm conferences and educate my patients and get them to lead a better and a healthier lifestyle.
This kind of conference is very enlightening. Now, it is comprehensive. Actually, I have been doing this kind of practice for 3 years now. Now I can look at a patient very holistically.
I joined Sahamm since it's been first time elected by Dr. Sahamm. He is a very open-minded medical doctor that bring us to a new paradigm of anti-aging and nutrition that we as a medical doctor, we have to learn and practice and do the application for our patient as well. And then the patient will increase the quality of life and their longevity forever.
What's in the textbooks is not everything that is true. I mean, a lot of times that people ask us things, we just give like the answers that we've memorized from slides or the answers that we've taken from teachers, and a lot of times I find that this idea of questioning facts, it's very poor. Maybe it's among Malaysian students, or maybe it's among students in general, but I think this kind of program, it really makes you question. I mean, they use the term cognitive dissonance, so I think a bit of that is very good.
Can it describe the average amounts of mercury level binding in the red blood cell if we check the plasma cell?
Mercury doesn't really live in the blood. It should only be there for a while, and if it's going to be there, it'll be sequestered somewhere else in the body. That's very dangerous. It even means that they've recently had some, and it's most likely eating fish in the last few weeks. However, if there's the view that you can be so toxic that it's starting to spill back into the blood. So the best test is definitely not a mercury blood test.
I always look at helping humanity from two angles. One is I can train doctors to be better doctors, and I want them to be healers, because as doctors we are supposed to heal people. We are not supposed to be sitting there and suppressing their symptoms. So Sahamm has always embarked on the idea of training doctors as well as creating this awareness among the public. So now what we have embarked on is a 6-module certification program for doctors. Okay. So the first 3 modules is certification, and the second 3 modules where doctors sit and get a master's certification in nutritional medicine. The current way of treatment, where we use therapeutic drugs, it's only to control the symptoms. It is not addressing the underlying causes. I strongly believe that at some point in time, all these nutritional medicine and bioidentical hormone therapies will be recognized, because this is the way forward.